Hello everyone. In this video, we're going to talk about myocarditis risk after vaccination because that's been in the news, and also recently Pfizer has released their data about vaccinating young kids age 5 to 11, and that is probably going to go to the FDA for an emergency use authorization pretty soon. So I thought it's a good time to look at risks of myocarditis in vaccines. This is the paper that kind of started it off. And in this paper, what they did is they mined the VAERS system. So that's the Vaccine Adverse Events Reporting System. And they looked at reports of myocarditis, pericarditis, myopericarditis, and chest pain. And then found that number and they divided it by the number of kids that have been vaccinated. And they came up with a number, and what they found out is they felt that amongst so males are the most likely, and so you see that males ages 12 to 15, there's 162 events per million, and 16 to 17, 94 events per million, and then amongst females it's 13 and 13.4, so much less, like 10 times less. So it looks like the highest risk is amongst males. Um, that are between ages of 12 and 15, and this 162 per million is pretty high. That's like almost 2 per 10,000. That's a really high rate for something like a vaccine. Like for another drug, that would be extremely low. A risk of 1 to 2 in 10,000 is extremely low. But for vaccines, that's kind of high. And so this is the paper that kind of started off the whole thing, and people have recognized that myocarditis is a risk with vaccination. Many people say that this is kind of a faulty paper because they're using the VAERS system, which is self-reported and is not verified data. So they are saying that it could be over-reporting or under-reporting, so it's hard to know um, which way the bias goes. So you kind of need a better data set, and luckily we do have a better data set, and this is this paper. And this is a paper that's out of Israel because Israel's done a ton of vaccination. And this is unfortunately not just in kids, it's in myocarditis across the population. So it probably underestimates the myocarditis risk in young boys. But what they did, this is the better data set because it's not self-reported, it's actual hospital records. So these are people that have been verified to have myocarditis, and it's against, and they have basically the data is much cleaner in this paper. And what they find out is that the vaccination was most strongly associated with a risk of myocarditis, which they said is about 2.7 events per 100,000. So instead of one per, so this is almost 10 times less of a rate than this previous paper. Now, what that means is that's across the entire population. So in the younger boys, it's probably higher than this 2.7 per 100,000. So if you look at their, this is the money figure here. And what it shows is the risk of these various events. And this is the thing that the other paper didn't have. It didn't have context. And the context is what is the rate of myocarditis if you get COVID-19? So you can't just look at the risk of myocarditis if you get the vaccination, because the option isn't vaccination or no vaccination, it's vaccination or possible infection, because vaccination protects you against infection. So if you don't get the vaccination, you're more likely to get the infection. So you have to think about what the risk of the infection is. So they looked at all these various things. So a kidney injury, does the vaccine does not. So 1 means makes no difference. So below 1 means it actually protects you. So according to this result, vaccination may protect you from acute kidney injury. That's probably sampling error and not really true. But probably at least we know vaccination doesn't cause kidney injury. COVID infection definitely does. There's like a 15 to 20% increased risk. Appendicitis, neither vaccination nor infection seems to make any difference there. Arrhythmia, vaccination, no risk. Um, Infection, a little bit of risk. Deep vein thrombosis, clots, very little risk or no risk with the vaccine. fairly significant risk with infection. Zoster infection, no risk. Intracranial hemorrhage, risk with infection, but not with vaccine. Lymphadenopathy, this is the one that has lymphadenopathy is in large lymph nodes, higher risk with infection, no risk with, I mean, higher risk with vaccination, no risk with infection. Heart attack, vaccines don't seem to cause that. COVID-19 infection does. Myocarditis, here's the one that both of them are higher. So vaccination definitely causes increased myocarditis risk, and SARS-CoV-2 infection causes increased myocarditis, but at a higher rate. Pericarditis may be a little bit higher, and then with vaccination, um, but the error bars cross the 1, and then pericarditis, yeah, it's more. And then pulmonary embolism, this is a blood clot in your lungs, does not seem to be, vaccination does not seem to cause that, whereas COVID infection does. And then in pediatric literature, we know that they found that let's see, I'm going to go down and find it. I think it's right here. Okay, yeah, here you go. So 1.6% of these children in Italy had myocarditis. So the risk of myocarditis is, in this paper, was 1 in 100 if you got the infection. And this is another paper out of Case Western that looked at reports of myocarditis, and they also used basically insurance data. So these are verified, it's verified data, and they estimated the risk at myocarditis risk was 876 per million in people that have infection. So they thought infections are probably underreported. So after adjusting, they thought that the adjusted rates were about 450. So myocarditis from primary COVID-19 infection occurs at a rate as high as 450 per million in young males. And they estimated that that is 6 times more likely than myocarditis after the vaccine. So myocarditis risk is higher with the vaccine. We don't know exactly where it is. It's probably something in the order, somewhere between 3 per 100,000 and 1 per 10,000. So that's a fairly large range, but the risk of myocarditis, if you get the infection, is probably 6 to 10 times higher based on which paper you're reading. So that's kind of the thing that you need to balance. You need to think there is an increased risk for myocarditis, so that's definitely real, and that's definitely something to consider. And the risk is somewhere between 1 in 10,000, which is pretty high, to about 3 in 100,000, which is fairly high, but like much lower. And then you have to balance that against the risk of, if you get the COVID infection, what's your chance of getting myocarditis? It's much higher. So if you think that you're 100% going to get exposed to COVID, the vaccine is much safer. Um, but if you have a job where you're probably not going to be around a lot of people, and you don't think you're likely to get COVID, then maybe the risk of myocarditis from vaccination is higher than your risk of getting infected and then getting myocarditis from it, because it's about 10 times higher. So if you feel like your risk of getting infection is like 10% or less, then in terms of myocarditis, it may be kind of a wash. But in terms of everything else, like intracranial hemorrhage, pulmonary embolism, pericarditis, arrhythmia, heart attacks, intracranial hemorrhage, for those things, clearly the vaccine is better. So just in the isolated case of myocarditis is how you can think of that. But I'll link these papers below, and you can read them yourself. But the myocarditis risk is real with vaccines, and that's a recognized and known risk factor for vaccination. Um, just have to balance that with the risk of myocarditis from actual infection. And that's the way you should think about it.